Hi everybody, my name is Derek and this is my coworker Peyton, and we will be talking with Dr. Victor Borden. Now, Dr. Borden, you are a professor of higher education and student affairs at Indiana University in Bloomington, and you're also the project director for IU's Charting the Future initiative and directed the Carnegie Classification of Institutions of Higher Education from 2014 through 2022, which is a mouthful. But no, thank you for having me. And
Thank
we're
you.
very excited to have you here today. And Peyton will kick us off with our first question.
Thank you.
So Dr. Borden, what exactly is accreditation and what forms does it take?
Okay. Well, accreditation is a quality certification process that is available both for university programs as well as for entire institutions themselves. So there are the two forms, institutional accreditation and program accreditation. And it involves having an external accreditation board, experts in the field if it's a particular program, general experts in higher ed if it's the whole institution. And they're given a set of standards by that board. The board establishes standards for program quality in those areas. So this happens a lot for professional programs, especially health programs, and education, teaching has certification and accreditation, as well as engineering and business. Some of the traditional liberal arts and sciences do not have accreditation, so it's primarily designed for professional programs so as to ensure that the programs meet the needs of the profession as determined by experts in the field, who are in effect peers from those kinds of programs from across the country or across the world, and they've been trained in doing the accreditation, what to look for, how to use those standards to assess whether an institution has the prerequisite quality to be deemed accredited. So it comes in those various forms, and it establishes a legitimacy and a credential for the university.
Okay, so what does the school essentially go through then to gain accreditation, and how does the school know if it has been accredited by the right type of accreditor? For example, some of the research that we've done, we've seen instead of whole schools getting accredited, we've seen specific programs getting accredited. So what would you recommend or advise?
Well, there are two different parts to that, and one is it essential to get your programs accredited? And that depends on the program. So for programs that require professional licensure, it is absolutely essential, or else your graduates will not get the licensure. So many places that look for employees in these professional areas like physical therapy, doctors, whether they be medical doctors, naturopathic medicine, they all have standards that they have to show that they have obtained in order to work. And so institutions need that accreditation in order to get the students who want to go into those fields. And the students who go into those fields want the programs to be accredited so that they can get good jobs.
So you just touched on this a bit, but what other benefits does having accredited programs offer an institution, and at what cost?
Right. Well, the benefits are generally program quality, and that is you go through the process of accreditation, which generally is receiving what those standards are and preparing a self-study report. And this speaks to what the costs are. It's the costs of actually doing the necessary preparation work for the accreditation. And it's considerable, which is why it tends to go in 5-year, 7-year, or 10-year cycles, so that it's not done too often. So it does take a lot of support from a university to have accredited programs, especially a research university, which is going to have upwards of 30 to 40 accredited programs. And so they need to have some institutional support, some expertise at the institution to help programs go through the process.